So ARAMIS is another interesting result reported at this meeting. Here we're talking about so-called non-metastatic castration-resistant prostate cancer. So these are patients on hormone therapy, rising PSA, typically a PSA doubling time less than 10 months, indicating relatively high risk of metastases. But they don't have metastases yet, so rising PSA castrate patients. We know that enzalutamide and apalutamide delay the development of metastases with a suggestion of an overall survival advantage, but not mature for the OS endpoint. This was the first report of darolutamide, a third contender in the androgen receptor blocker category. And we got a robust result for metastasis-free survival, a significant increase from median of 18 months in the control group, about 40 months in the investigational group. That's in line with what we've seen before for enzalutamide and apalutamide. We don't have mature overall survival data. Time will have to tell where we land on that, but similar trends that we've seen for the other drugs, hazard ratio of 0.71. I think what stood out about this trial to me is the toxicity data. So remember here we're treating patients without metastases. They're symptomatic largely from their treatment, not from their cancer. And both enzalutamide and apalutamide are known to cause fatigue, some cognitive defects, falls. All of these things we think are due to central nervous system effects of the drug. Darolutamide was designed to have a lower CNS penetration. It's less likely to cut across the blood-brain barrier. And interestingly, we saw a significantly lower level of fatigue than we've seen with the other agents. No increase in CNS complaints or falls over placebo. Now, we can't really compare across studies, of course, but it was quite encouraging to see that falls and cognitive complaints were no more common than in placebo, and the fatigue rate was about half of what we've seen with the other drugs, suggesting that perhaps darolutamide will prove to have an advantage for patients with regard to toxicity while achieving a similar level of delay in metastasis development. So we need to see the mature data. This is the initial analysis. We don't have direct comparisons between the drugs yet, but that's what I think got the attention of the audience, is similar, apparently similar efficacy to what we've seen before, and perhaps a lower toxicity related to lower penetration into the central nervous system.